Hi, my name is Marcus Davis. I'm a consultant plastic reconstructive and cosmetic surgeon, and I work here at One Hatfield Hospital. An abdominoplasty is the medical term for a tummy tuck. That's the common name out on the street, is a tummy tuck, and this can take various different forms. The simplest form, or the smallest form, is a mini tummy tuck or a mini abdominoplasty, and this is applicable for women that may have a little bit of excess tissue, skin, fat below the belly button. When you've got too much or you've got excess above the belly button, then you're entering the realms of requiring a full tummy tuck. And then there's another variant where you have a little bit of liposuction along with the tummy tuck, and that's called a lipo-abdominoplasty or a Brazilian tummy tuck. People that typically request abdominoplasty, I would honestly say that varies depending on several factors. There's the patients that are slightly overweight and they want a more trim waistline. These patients I would always advise to go and lose weight because abdominoplasty is not a weight loss procedure. Weight loss should be done before the tummy tuck. Get yourself down to a healthy, stable weight, ideally with a body mass index of less than 30, and then come see the surgeon and have any excess skin fat removed at that point. Others that request the abdominoplasty are massive weight loss patients where they might have had a gastric bypass or a gastric balloon or a gastric band. They've lost their weight. You need to have lost all the weight, got down to a stable weight, and then been at that weight for at least a year so that your metabolism recovers before coming to have it. So they're effectively having all the excess loose skin removed to tidy themselves up and sort of have a more acceptable appearance and improve their self-esteem. It also helps with clothes fitting. Others that come are females more than males in terms of they've had pregnancies, their abdomen's been distended and stretched by one or multiple babies. They've got stretch marks down on the lower part of the abdomen that they want ridding of. Their tummy muscles have separated, so they've got a little bit of a bulge, what we call a rectus diastasis or rectus divarication, and we can repair those tummy muscles at the same time to flatten the tummy down. The advice I'd give to anyone considering an abdominoplasty is come and see a board certified surgeon. So here in the UK, that's someone with FRCS Plast after their name, because you know they've gone through rigorous training and met the national acceptable examination standards in order to be put on the GMC specialist register for plastic surgery. Other advice for the patient, this is not a weight loss procedure. Go and lose any weight that you want to lose, get your body and weight stable, and then come and see for assessment. Because if you came for an abdominoplasty, you have the surgery done and then you go and lose weight, you may then have loose, hanging, unattractive tissue, and then you're effectively back to square one and needing further surgery. You just want to have the surgery done once and once only. The other thing to say is that this is a procedure that can help remove the excess skin and some fat from the abdominal tissue or the tummy area, to give you a nicer waistline, nicer shape, but it doesn't deal with any fat that's surrounding your organs or what we call visceral fat behind the tummy muscles. So you sometimes see people that come in with a bit of a belly on them, but actually when you pinch the skin, there's not much skin and fat there. Most of the weight and the fat is behind the tummy muscle, and there's nothing that the surgeons can do for that. That's diet, exercise, cutting down on your sort of daily glass of wine, etc., that will target and help with that. Alternatives to tummy tucks do exist depending on the patient. Now, if you've got loose, hanging, excess skin, there's nothing else that's going to do. If you're sort of slightly plump, you might not be the best candidate for a tummy tuck because you might not have the excess skin in order to get the skin from essentially above your belly button down towards your waistline, and liposuction may be the way ahead for you there. But liposuction comes in the traditional technique of just removing excess fat. What they're doing there is taking away the deep fat but they're not sculpting you. I perform something called high definition liposuction or high def liposuction, whereby you don't just take away the deep fat, you take away some of the superficial fat around the muscles. So sort of for a female, you want to give a nice sort of S curve at the edge of the rectus muscle, so you would thin out the superficial fat between the muscles and the hips, for example, going outwards, and then it focuses the eye and draws the eye more on that natural curve. And then for the men, you can etch it or high definition around the six pack to give them a more sort of toned abdomen to show off at the beach or the swimming pool. The recovery time after surgery depends on what you've had done. For a mini tummy tuck, it's less invasive than, say, a full tummy tuck or a tummy tuck with liposuction. And my general advice for everyone is take at least 2 weeks off work. You may go back to work after a week, especially on the mini tummy tuck, but realistically on the full tummy tuck, you will want that 2 weeks off work. And the liposuction, if you have that as well, to sort of target the flank areas, you'll feel a bit bruised and battered after liposuction and a bit tender. So going back to work, especially if you've got a physical job, definitely not within 1 week, and definitely take the 2 weeks off work. You're not going to be back to full exercise and fitness and way of life for at least 6 weeks. Results vary from person to person, and in our consultation we'll sit and discuss what your goals are, because I need to know what your goals and expectations of the surgery are in order to and then examine and assess you to assess whether they are, one, realistic, and two, if I can achieve them for you. Because occasionally people come in and I cannot achieve those goals, and I'll be honest with you and I'll tell you I'm not your surgeon. So it's a very individual thing as to what people can expect. The one thing to say is that the results are not permanent. When you come and you have a tummy tuck, liposuction, or a combination of the both, we're removing tissue from the body, so yes, you will be lighter. Initially you may be at a status quo because the body naturally swells and holds on to fluid, but after 6-12 weeks, when the swelling's gone down, you will be lighter. However, if you then go back to an excessive lifestyle, you'll put weight back on and you'll undo all your results. Patients can be referred to me by going onto my website, www.mdaesthetics.co.uk, or simply phoning 1 Hatfield Hospital, speaking to one of the advisors here, who can quite simply book you into my clinic to come and see me, or put you in touch with my secretary to book you into my clinic to come and see me.